So, what color is cancer? This is one of the most common questions I get as a pathologist. I'm Dr. Wolf, a pathologist of 20 years' experience, and I've seen thousands of cancers. So, first of all, you have to understand that cancer is not just one disease, and therefore there is no uniform color for cancer. Cancer is hundreds of different types of a disease of cellular proliferation, okay? And this is based on the tissue type, the origin of tissue type from which that cancer comes. But there are also other factors like are there pigments in the cancer? Is there hemorrhage within the cancer? Things like that. So let's talk about some basics. So I kind of divide cancers into three sets: epithelial tumors, tumors of soft tissue / connective tissue, and lymphoid tumors. So if we start with the first one, epithelial tumors probably going to be the most common. This is your basic breast, lung, colon, that pancreas, that sort of thing, and also skin cancer. And then when you move on to the soft tissue or connective tissue type cancers, these are probably the least common. And that's going to be things like cancers that arise from blood vessels, from muscle cells, from cartilage. And then the last one being lymphoma. You have tissues of the lymphoid system, lymph nodes and of course bone marrow. And those, all three of those kind of have different appearances. There are generalities like lymphomas sometimes are referred to having a fish flesh appearance, meaning it's very soft and white appearing, but they don't always look like that. Epithelial tumors a lot of times will induce a scarring or fibrotic reaction, which causes the tumor to have a whitish gray appearance. And then soft tissue tumors, those are kind of unpredictable on what they're going to look like. Some of them can be pigmented, and some of them can be very soft. Some of them can be more firm, depending on the tissue of origin. And then you've got examples like melanoma, which you think are pretty standard. They're going to be black or very dark brown, bluish, unusual looking mole. And yet there's a type of melanoma called amelanotic melanoma. And so here's an example of an amelanotic melanoma. You can see that it is kind of a pinkish red color, and it's pretty well circumscribed. But this is as dangerous or maybe even more dangerous than a standard melanoma because they tend to get overlooked because they aren't that dark brown black, and they can spread before we realize they're a melanoma. And then this is a kidney cancer called clear cell renal cell carcinoma. This yellowish nodule is the cancer. And it's a very typical appearance for renal cell carcinoma because these cells contain glycogen. And that's what it looks like under the microscope. These cells are actually cleared out because they contain a lot of glycogen. The point of this example is that the tumor appearance will depend on the cellular appearance. What do those cells look like? What do they contain? What substances do they contain? Like if they hemorrhage and then they resorb that hemorrhage, the hemoglobin, they break it down into something called hemosiderin, it might look brownish. Versus in this case it didn't, so it remains kind of that yellowish color, which is what glycogen looks like, glycogen-rich tumors look like. Meanwhile, you've got this example of another kidney tumor. Now this one's more of a light brown, tan, orange color with a central scar. This is called an oncocytoma. And this tumor has this appearance because the cells contain tons and tons of mitochondria, which is why they stain pink here in hematoxylin and eosin staining. The point of all of this is cancer is a heterogeneous group of diseases, and the appearance depends on the site of origin and what those cells may look like or contain based on substances within the cell or organelles within the cell. And I realize this was kind of a long video for a simple question, but sometimes simple questions have complex answers, and pathologists will tend to fritz out a little bit when presented with such a question because there's no easy way to answer it.